We are going to continue administrative drugs. Now here, this is a summary table for therapeutic uses of these drugs. Now we first will study the catecholamines. Catecholamines were 5 epinephrine, norepinephrine, isoproterenol, dopamine and dobutamine. Epinephrine acts on both alpha and beta. Norepinephrine except beta 2 it acts on all. Isoproterenol is beta non-selective. Dopamine is alpha 1 and beta 1 plus dopaminergic D receptor. Dobutamine is only beta 1 selective. Anaphylactic shock, cardiac arrest, local anesthetic to increase the duration of action. Norepinephrine treatment of shock. Isoproterenol as in cardiac stimulant. Dopamine treatment of shock, treatment of CHF and high BP. Dopamine treatment of acute heart failure. These catecholamines have rapid onset of action, brief duration of action as they metabolize rapidly. So in GIT, therefore they are also not administered orally and they do not enter BBB. Versus with non-catecholamines, they have longer duration of action and they can be administered orally. Oxymetazoline, phenylephrine, clonidine. These are alpha. Oxymetazoline alpha 1. So it is used for nasal decongestant and eye redness. Phenylephrine alpha 1 also nasal decongestion, high BP and paroxysmal supraventricular tachycardia. Clonidine acts on alpha 2, treatment of hypertension. Albuterol, metoprolol, terbutaline acts on beta 2, treatment of bronchospasm, short acting. Alphomoterol, formoterol, indacaterol, salmeterol, they are acting on beta 2, same as this treatment bronchospasm, but the difference is they are short acting and these are long acting. Now amphetamine acts on non-selectively alpha, beta and in CNS. So it is used in CNS treatment of children, ADHD and for appetite control. Ephedrine and pseudoephedrine, they are also non-selective and CNS and used in high blood pressure and as a nasal decongestant.